Welcome to Regen, MD. My name is Dr. Gurpreet Singh Pata. Chronic foot pain, specifically refractory plantar fasciitis or plantar fasciosis, is not merely an anatomical inconvenience. It is a slow, relentless theft of your human autonomy and the daily joys that define a meaningful life. I know the exact emotional tax this pain extracts from you. It is the agonizing ritual that greets you every single morning. Before you even open your eyes, you feel a deep sense of anxiety because you know what is coming. The moment your feet touch the floor, a searing white-hot blade shoots through your heel, making your first steps look and feel like you are walking across shattered glass. You find yourself limping to the bathroom, holding onto walls, waiting for the tissue to desperately stretch out enough to allow a normal gait. This pain slowly alters the architecture of your entire day. It is the profound frustration of realizing you can no longer go for an evening walk with your spouse or run around the backyard with your grandchildren. You find yourself planning your life around seating arrangements and choosing shoes based entirely on survival rather than style. You have likely spent years caught on a corporate healthcare conveyor belt, processed as a diagnostic code. This volume-driven insurance model dictates rationing based on quarterly profits for conglomerates rather than your long-term clinical benefit. You are rarely treated as a human being with an active life to reclaim. Instead, you are processed merely as a diagnostic code for plantar fasciitis. This system relies on a reactive checklist of temporary patches that fail to address the root cause of your tissue degeneration. The term plantar fasciitis is frequently a misnomer. In chronic cases, histopathological evaluations reveal plantar fasciosis, a degenerative, non-inflammatory breakdown of the collagen matrix, characterized by microtears, hypercellularity, and a distinct lack of vascular repair. When a clinician injects a potent corticosteroid into tissue suffering from degenerative decay, they are pouring gasoline on a structural fire. Cortisone is inherently catabolic. It temporarily shuts down pain signaling by suppressing cellular pathways, but it simultaneously halts repair. While you may experience a brief window of artificial relief for a few weeks, your underlying structural terrain is being silently dismantled. The hard longitudinal science proves that this approach is a biological trap with severe long-term consequences. Data demonstrates that local steroid injections carry an unacceptably high rate of structural failure. Published clinical series identified a clear, statistically significant correlation between the number of steroid exposures and the incidence of acute fascial rupture. When the fascia tears completely, the natural shock-absorbing mechanism is destroyed. Furthermore, cortisone carries a severe risk of localized fat pad atrophy. The specialized adipose tissue beneath your heel bone acts as your body's primary shock absorber. When this fat pad wastes away, the structural protection of the calcaneus is permanently compromised. Patients are left with direct, unmitigated mechanical pressure of the heel bone striking the ground, a condition far more painful than the original fascial irritation. When injections inevitably fail, you are directed to a surgeon for a plantar fasciotomy. This procedure is routinely presented as a definitive structural cure. In reality, it represents a highly aggressive, irreversible mechanical alteration of human foot kinematics. Foot surgeries are one-way tickets with absolutely no return option. Once you resect your native fascia tissue, you cannot undo the intervention. Systematic reviews document that between 10% and 50% of patients are left completely unsatisfied following surgical release. To understand why the failure rate is so staggering, we must evaluate the foot through the lens of biotensegrity. The plantar fascia is not an isolated piece of tissue. It is the primary structural tie rod that maintains the stability of the medial longitudinal arch. It functions via the windlass mechanism, tightening as the toes dorsiflex. Long-term biomechanical trials from institutions like Johns Hopkins have proven that division of the fascia significantly reduces arch stiffness, leading to a measurable flattening of the arch. After a fasciotomy, weight shifts abnormally. Because the heel can no longer transfer loads properly, stress is forced onto the midfoot, triggering secondary complications like lateral column pain, cuboid syndrome, and accelerated osteoarthritis. This realization is precisely why we executed a complete institutional paradigm shift at Regen, MD. We completely reject the outdated model of tissue subtraction, focusing instead on advanced biological restoration, utilizing target-specific orthobiologics. Our approach harnesses your body's own localized cellular pharmacy to heal degenerative environments from the inside out. Our institutional protocols integrate three primary agents: high-density PRP, microfragmented adipose tissue, and platelet lysate. PRP delivers a supraphysiologic concentration of essential growth factors directly into chronic microtears. These signaling proteins act as specialized repair workers, commanding local cells to clear away debris and restart the stalled collagen synthesis process. Microfragmented adipose tissue, or MFAT, represents a powerful autologous cellular scaffold. It contains a rich population of perivascular cells, providing a biological matrix to structurally support the fraying layers of the degenerative fascia. Platelet lysate is a specialized formulation where we break open the platelets upfront to release the entire payload immediately. We deploy this around delicate neural pathways to resolve neuropathic burning without localized chemical irritation. The strategic value of our framework is established by long-term, longitudinal data. A landmark September 2025 meta-analysis published in Foot and Ankle Specialist analyzed 13 prospective randomized trials involving over 900 subjects. The data demonstrated that while short-term outcomes were comparable, a massive clinical divergence emerged by 18 months. The cohort treated with PRP achieved overwhelmingly superior results with a significance of p less than 0.00001. The PRP group demonstrated durable improvements in pain reduction, function, and a measurable structural normalization of fascia thickness. This stands as a scientific testament to the difference between symptom masking and genuine disease modification. Absolute spatial precision is non-negotiable. At Regen, MD, every procedure is performed under continuous high-resolution ultrasound guidance, mapping your anatomy to the sub-millimeter level before a single needle is advanced. This visualization ensures cellular repair agents are deployed exactly into the site of tissue breakdown, maximizing concentration where integrity has been lost, and eliminating the risks of mechanical nerve injury associated with surgery. Delivering cells is only half the equation. We must prepare the physiological soil. If we inject biologics into a patient whose systemic physiology is highly inflamed or biochemically depleted, those cells will arrive at a hostile terrain and fail. This is why our protocol includes mandatory metabolic screening. We analyze your complete blood count, A1C, and hormone profiles, including estrogen, progesterone, and testosterone levels, to ensure your body possesses the tools to achieve a durable healing response. If your A1C is elevated, your body exists in a pro-inflammatory state that actively drives tendon decay. If your hormone levels are depleted, you lack the critical anabolic signaling required to rebuild connective tissues. We optimize your biochemistry. I believe in being fiercely honest. Healing is a complex, nature-paced biological process, not a fast commercial transaction. Biologics require a realistic timeline to properly signal, recruit local cells, and remodel tissue. Those patients who respect the cellular timeline, who commit to systemic metabolic optimization, and who execute proper biomechanical rehabilitation become our greatest success stories. Those who insist on quick fixes remain trapped in a failing system. Success means stepping out of bed with a pain-free stride, walking through the St. Louis airport terminal without hesitation, or enjoying golf with total mechanical power. It means reclaiming the everyday moments that define your life. Take back your medical autonomy. We provide the imaging, metabolic analytics, and advanced cellular protocols required to fix your underlying terrain permanently. I look forward to meeting you in person during our upcoming clinical consultation.